My name's Tim Cox, and I'm here to try and explain to you how we're getting along with the Gaucherite project, where it's going, what it's really about, and how I hope I can increase your enthusiasm for it and engagement if possible. This project has been funded by the Medical Research Council of the United Kingdom and is based at all the specialist centres in England that see UK patients with this disease, the disease that you know only too well. Our idea is to deepen our understanding of the condition, particularly those aspects that matter to you very much, affect your quality of life. For example, the condition in the blood, which causes fatigue or a risk of infection, the condition in the skeleton and bones, which cause pain at some times and some disability requiring interventions, and also in those patients that have the neurological condition affected, where we seek to understand how that comes about and how it might best be treated. New treatments are really coming into Gaucher disease, and this stratified medicine project is to understand how each person responds separately to the different treatments, and also to understand really how they're working. We've got great hopes already that we are understanding something we didn't know before, particularly in the skeleton, and we're collaborating with other groups that are working on, for example, Parkinson's disease and the neurological complications worldwide, really to understand the full burden of the condition and how it might best be tackled. We have a big team, and you'll be meeting, as it were, in this video, people to explain more about the project. It is going extremely well. It is not particularly invasive. It does involve a database that keeps ethically your clinical information and those things that matter to you about your condition on a secure database that will be used for research, we hope, in perpetuity. And also we have special samples collected at the time of your routine visits that enable us to do further research in the future. We're looking to take the project beyond 2017 in the long term through the National Institute of Health Research here in the UK to understand the condition and work with it as something very special in this condition worldwide. It's very rare, but we need to understand it because it has so much to teach us and so much good we think can be done and optimized for you with the existing treatments.
A patient information sheet and consent form will be sent to you prior to your next routine clinical appointment by a member of staff from the hospital you attend. This may be followed up by a telephone call to discuss the study. This varies from hospital to hospital. You will now come in for your normal routine clinical appointment. The patient checks in at reception as normal and will then be seen by their specialist nurse. A member of the clinical team will introduce you to a member of the research team. A member of the research team will discuss the Gaucherite study with you. This forms part of the screening baseline visit. They will discuss with you the commitment required from you as the patient or parent guardian. Consent can be taken by either your clinician or a member of the research team. The research team consists of the research nurse or one of the two clinical fellows. In the event that the patient agrees to take part in the study, they will be asked to sign and date a consent form in front of the person taking informed consent. This person will also sign and date the consent form. The patient will be given a copy of this form and a copy will be put in their medical notes. The patient is now enrolled in the study. The patient, parent guardian, will be asked to complete some questionnaires in clinic and then asked to return them to a member of the research team. Depending on diagnosis type, the patient may be asked to undergo an examination from one of the clinical fellows. The patient will be advised of this at the time of consent if it applies to them. Patients will have their normal vitals taken and blood and asked to provide a urine sample by their clinical team. If the patient has consented to giving additional blood and urine for research, the blood will be taken at the same time as their normal safety bloods by someone in their clinical team, and the urine sample will be divided. The patient will then be seen by their normal clinician. At future routine clinic appointments, patients will be asked to complete some questionnaires and give blood and urine for research purposes. They may also be asked additional questions about their medical history by a member of the research team. The patient will now be seen by their normal clinician and specialist nurse. No, we see you at your normal routine clinic appointment. We are hoping to recruit 250 patients from the age of 5 years and upwards from the 8 lysosomal units in England. This is stored anonymised in our bespoke Gaucherite database. During the study, we will carry out interim analysis. The results from this may be presented at conferences or in journals. This data will also be shared with your clinicians. You will only be asked to have this procedure if we cannot establish what your white cell enzyme result was prior to you starting enzyme therapy. You have the right to refuse to have this test done. Your anonymised samples will be sent to our central labs for analysis. Some of these samples will be frozen and sent to our Oxford lab for future research into Gaucher disease. If you choose to withdraw from the study, you can also ask that we destroy any samples stored on you. At the screening visit, the consent process can take approximately 15 minutes. Completing the questionnaires varies depending on the disease type. Type 1 patients generally take about 15 minutes. Type 3 patients can take up to 45 to 60 minutes to complete all questionnaires.
In summary, I've told you about the Gaucherite project, a national project for Gaucher disease in the UK, which is now well underway. What we are collecting is of inestimable value, not just for now and understanding how the current treatments are working in this condition, but also for the future and for the new treatments which are very much coming in. Our team will explain to you all the aspects of the work as it now is. I'd like to thank you for listening and for considering and taking part if you haven't done already. We'll be reporting back to you in the near future.